Strain reduction principles for the lumbar spine, educating you pre-surgically on how to take stress and strain off your low back for a post-surgical recovery. Applying these principles to reduce strain on your low back during recovery can help to avoid future injuries and/or possible future surgeries.
Hi, my name is Mark, and today we're going to be talking about strain reduction principles for your spine. Core stabilization is a term we use when we talk about the muscles that are naturally there to stabilize your spine while you move about. This usually happens spontaneously or subconsciously, automatically, when you go to move. But right after a spine injury, or especially after spine surgery, those muscles have a tendency to go on vacation. So our job today is to teach you how to retrain those muscles to stabilize and support your spine, to take strain off of your spine while you move throughout the day, to hopefully prevent further surgeries and/or injuries. So there's 5 things we're going to discuss. The first one is tall spine. Second is packed shoulders. Third is tight belly button. And then while we hold that posture, we're going to work on breathing, and we're going to work on bracing when we need to. But first things first, let's cover tall spine, what that is and how that looks. My friend Katie's going to help us out with that.
Typically, our posture is not what it needs to be to take stress off our spine. When you stand with a tall spine, packed shoulders or shoulders back, and a tight belly button. When you're in a slouched posture, your pelvis rolls backwards and your shoulders round forward. Another common posture is an overextended posture where the low back is rounded too far out, with this being somewhere in between as neutral. This is overextended, and this is neutral, with a tall spine, packed shoulders, neutral pelvis with a tummy tight. While standing with a tall spine, packed shoulders, and a tight belly button, you want to breathe with your diaphragm. When you breathe with your diaphragm, your upper stomach will push out a little bit when you inhale, and then pull back in as you exhale. You'll want to maintain a tall spine, packed shoulders, and a tight belly button with all your activities of daily living to take stress and strain off your spine. But if you need more than that for some activities, you'll need bracing, pulling in all your abdominal muscles, front and back, side to side, to create a tension throughout the entire core. So now we're going to discuss some common things that can typically strain your spine post-surgically. But by performing the tall spine, packed shoulders, tight belly button, and bracing when needed, how you can avoid that strain for a positive recovery. Sitting can be a major cause of lumbar spine stress. If your chair doesn't naturally give you a tall spine posture, you can use a towel roll or a lumbar support to help give you that tall spine posture by supporting your lumbar spine in its natural curve. And when transferring from a sitting position to a standing position, tall spine, packed shoulders, tight belly button, and then use your arms to help push you forward and then push you up, keeping your spine as straight and tall as possible so as not to overstress the spine. Lower yourself and sit in the reverse fashion. Picking up objects off the floor can put a lot of strain on your lumbar spine as well, re-injuring or further injuring your low back. So when you're picking up objects, think about tall spine, packed shoulders, tight belly button, and then perform a squat, keeping your spine tall, to pick up the object. An alternate way to pick up small, light objects is tall spine, packed shoulders, tight belly button, and then perform a golfer's lift where one leg goes out behind you to counterbalance your upper body weight. When going from laying down on your back to sitting up, once again, tall spine, packed shoulders, tight belly button, and breathe diaphragmatically as you roll onto your side like a log, and then use your arms to push yourself up as your legs drop off the side of the bed, keeping your spine as tall and straight as possible with your packed shoulders and tight belly button. To lay back down, simply reverse the order. Thank you for watching our presentation on some strain reduction principles for your spine. We heavily encourage you to practice what it feels like to have a tall spine, packed shoulders, a neutral pelvis with a tight belly button as you move throughout your day pre-surgically to help you move better post-surgically. The more you practice, the more successful you can be. You'll also want to practice your bracing technique, drawing in all your abdominal muscles to create a rigid tree trunk-like spine as you move so as to prevent any further injuries and potentially any further surgeries. Have a great day and good luck with your recovery.